My name is Amarachi.
And my name is Erin.
And welcome to the Prescription for a Healthy Oakland program, where we help you achieve your health goals. In today's video, we are going to talk about advocating for your health. Our stress management portion today will be about managing your media consumption. Let's get started. It can be a little intimidating at times making sure that your voice is heard when sharing your health goals.
Advocating for your health is important for a variety of reasons. Most importantly, because if you don't do it, who will? You may have family members or close friends that help you navigate the ups and downs of health, but even so, you still need to make your voice and your preferences heard. You also need to have an awareness of what's going on and stay informed so that you can make the best decisions for your health alongside your doctor and anyone else who is on your healthcare team. Advocating for your health can be an empowering thing, so don't be afraid of it. You are the one who knows yourself best.
Here are a few simple ways to help you advocate for your health. 1. It is important for you to understand this. You matter. Your health matters. It is important to those who love you, care for you, and for yourself to know this, or else it will be difficult to effectively advocate for yourself.
2. Know your patient and medical rights. This includes your right to know your options, your right to a second opinion, and your right to privacy, also known as HIPAA, the Health Insurance Portability and Accountability Act, which you've probably heard about. If you don't know what your rights are, that's okay. Feel free to ask your healthcare provider for more information or speak with a patient advocate or legal counsel. It's important for you to know that you have rights and that there are certain laws and guidelines that protect these rights so that you don't get taken advantage of, led down the wrong path, or have your medical information shared without your permission.
3. Be assertive. Have clear expectations and communicate what you want and what your concerns are to your healthcare provider.
If you don't think that you can be assertive, seek the support of a trusted family member, friend, or advisor and ask them to accompany you to appointments or sit in on calls with your doctor. Having someone with you can give you the extra confidence and support that you need, especially when it comes to conversations about serious health conditions that can be overwhelming, stressful, and even scary. It can be helpful to have someone there to take notes and listen for the important details that you might miss.
Next, when you're speaking with a medical provider, member of a healthcare team, or a health professional, feel free to ask for clarity if you don't understand the health information they are telling you. Never make a decision based on information you do not understand.
If it helps you, repeat back to them what you heard to be sure that you understood what they are explaining to you.
Share with your healthcare provider your cultural or religious beliefs. Most organizations and clinics have guidelines that will accommodate your needs. If English is not your first language, ask for an interpreter. Even when you're selecting a care provider, make sure bilingual services are available. This is to ensure that there is no confusion in the information you are sharing or receiving from your healthcare provider. Lastly, don't be afraid to get a second opinion. Again, it may seem like you're wasting time or that you may offend your current healthcare provider, but it is your health. You have the right to ask for more advice or further insight based on your healthcare needs. Who knows, you may find out something new or gain more information that can be beneficial to your overall health.
A bonus tip: take some time to think about setting up an advance directive, a life insurance policy, and selecting a power of attorney, also known as a POA. An advance directive is a legal document that states what your medical wishes are should you ever be in a condition where you can't make these wishes clear. A life insurance policy is important because it allows you to leave your family or loved ones a non-taxable amount of money that can help to cover funeral costs and other unexpected expenses that occur when someone dies. Consider finding a small, inexpensive one through a reputable life insurance company. Power of attorney is giving someone you trust the ability to make decisions on your behalf in the event that you can't make decisions for yourself. Although all of these things can be scary to think about, it's important that we are aware of our options ahead of time and make a plan. It's never too early to prepare. If you're unsure about any of the things I've just talked about, speak with your healthcare provider or patient advocate to learn more. Moving on, let's talk about staying organized so that all of your medical information and prescriptions are easy to access when you need them. It can be overwhelming to keep track of these things, so here are some easy ways to help you effectively keep records, save money, and advocate for your health. First, have a list of your prescriptions with you at all times. Whether you print your list, handwrite it, or have an app that you track them on, this list will come in handy when you need to know exactly what prescriptions you take, as well as the dose and frequency, or how much you take them. This is important information when you are consulting with new doctors, specialists, or visiting the emergency room or urgent care. You'll find that this is typically one of the first questions they ask. If you're looking for a way to electronically track this information, Mango is an app that allows you to store your prescription info, see the side effects of certain medications, and even set timers to take your medications. You'll find a link to this app on the resources page of our website.
Decide to fill your prescription for a 90-day quantity versus a 30-day quantity. This also helps you save money.
Next, try using prescription discount programs or mail order pharmacy services to help you save time and money. Prescription discount services like GoodRx or America's Pharmacy allow you to compare the copay or price of a prescription across several different pharmacies. For example, you can plug in your medication name and your location and see all of the local places you can fill this prescription and how much they charge for it. You can even text yourself coupons or save them to your phone. Mail order pharmacy services will ship prescriptions right to your door, allowing you to fill in larger 90-day quantities and oftentimes giving you a discount. Some examples of these are Express Scripts Pharmacy and PillPack, which is through Amazon Pharmacy. You may want to check with your doctor first to see if they will prescribe to companies like this.
Now that we've had the chance to talk about simple ways to advocate for your health and manage your prescriptions, let's talk about additional resources that may be helpful to you while navigating the healthcare system. Utilize patient portals. A patient portal is a secure online website that gives patients convenient 24-hour access to personal health information from anywhere in the world with internet connection.
You can create an account through your provider's patient portal anytime. Typically, you just need to answer a few basic questions like your name and birth date and select a username and password unless your provider gives you one to start with.
In a patient portal, you can view recent doctor visits, medications, immunizations, allergies, and lab results. Some patient portals even allow you to securely message your doctor, request prescription refills, schedule appointments, check benefits and coverage, update contact information, make payments, and view educational materials. Patient portals through major hospitals or other nonprofit organizations help consolidate all your patient history in one setting for easy access and cross-reference. Using these systems help you save time, communicate directly with your doctor, give you the upper hand in monitoring clinic information, and helps you ensure proper documentation of your health journey.
Sometimes your healthcare journey might be confusing or challenging, and it can help to have someone walk you through each step and support you. Well, you're in luck. There is someone that can do that for you, and they are called care coordinators. They are trained professionals whose job it is to help educate you on your health conditions, answer questions you may have, assist with contacting your providers, and connect you with other resources that may be useful to you. You can contact your health insurance to learn more about care coordinators and see if you are eligible for one.
Last but certainly not least, primary care. Making sure you're up to date with primary care visits, even for your entire family, can help you safely monitor your health. This may seem tedious, but doing simple things like scheduling yearly or quarterly checkups for you and your family can save you in the long run, as well as help you monitor any changes that may impact your ability to advocate for your health. Now that we've talked about ways we can navigate the healthcare system, let's move on to our stress management topic for today on media consumption. Though the media keeps us informed and has provided great social engagement with people and news all over the world, it can pose some dangers to our overall mental health. According to research, when it comes to social media alone, 69% of adults and 81% of teens in the US use it. Social media use in particular is connected to decreased, disrupted, and delayed sleep, which is associated with depression, memory loss, and poor academic performance.
What does this mean for you? Well, in your health and wellness journey, you are your own best advocate and cheerleader. Part of this is recognizing any negative influences or stressors in your life. As great as social media can be, if we allow ourselves to become too involved in it, we may lose sight of reality and compare ourselves and our lives to others. Or if we invest too much time in it, we cut back on other important aspects of life like sleep, physical activity, and connecting in person with others. It's important to have a good balance, and if you feel like it's taking up too much of your time or you feel more negative when you get off of social media, perhaps it's time to take a step back from it.
To help you, here are 5 simple tips to encourage you to maintain your media consumption. Tip number 1, set timers, time limits, on your apps, your TV, or other media outlets. Most smartphones and TVs have applications to help you. Tip number 2, only receive information from certain sources or channels. Sometimes streamlining where you're receiving your information can help eliminate any form of distraction or your overall media consumption. Tip number 3, set boundaries for children if you have any. Monitoring your children's screen time early on will eliminate further distractions for them and also help them achieve their health goals. Tip number 4, put cell phones away at bedtime, meal times, and family time. And tip number 5, replace your time with family, friends, and other social activities. These are simple ways to help you decrease your media consumption and promote other ways of social connection. Wonderful job for finishing this video on advocating for your health and managing your media consumption. Keep using these skills to help you navigate the healthcare system and empower you to achieve your overall health goals.